All right, video number 3 in our final video, talking about some musculoskeletal structures and functions and dysfunctions. So let's go here real quick. If we look at the trapezius muscle, everybody knows these are your traps, right? These muscles here, right up in the shoulders. But actually the trapezius muscle inserts into the occipital bone there, comes all the way down laterally and down here, down to T12, which is your 12th thoracic vertebrae. Now it's stripped off this side so you can see the underlying structures. It's on both sides, so it looks like a big kite, okay? So that big muscle there is a trapezius muscle. So if you have dysfunction anywhere in there, it can cause headaches. You can get trigger points up here, but even trigger points in there can cause some pulling and discomfort in the neck and head, mid-back discomfort, things like that, depending on what areas might be affected. Okay, now let's go to lower extremity. So if we go down here, just a couple muscle groups again, so we can learn a little bit about muscle groups. Let me angle this a little bit down, right there. So we've got 4 muscles in the quadriceps. Quad means 4, okay? I don't think we're gonna be able to see one of them, that's okay. So we have the rectus femoris here. This is the vastus medialis, this is the vastus lateralis. If we were to pull this off, we would see underneath it a vastus intermedius, which is the 4 muscles of the quadriceps. If we go to the back, hamstrings, we have 3 muscles, okay? The lateral hamstrings, which is the outside there, the lateral hamstrings is called the biceps femoris. By the way, the biceps up here is called the biceps brachii. That's the technical correct term for it. If we come on this side, the medial side, we have 2 muscles that make up the medial hamstrings. You've got this one called the semitendinosus, and underneath it, here and here, you can see it peeking out, called the semimembranosus. So what I like is this model cuts off the semitendinosus. You can see the semimembranosus underneath it. So we've got 3 muscles, okay, that make up the hamstrings. You've got the biceps femoris, semitendinosus, semimembranosus, and those are our 3 muscles there. Our calf group, and then we'll talk about a few more dysfunctions before we wrap up. The calf group is made up of the gastrocnemius, which are the 2 heads of the calf, right? And then if we go deep to it, so you can see it here, but let's do it on this one. So we go here, is the gastrocnemius, this outside portion. The deep one, so we see it there, they have both of them cut, but the deep one to the 2 heads of the gastrocnemius, that's called the soleus. So the soleus and the gastrocnemius come together with one common tendon, okay? It's called your Achilles tendon or your calcaneal tendon. So those 2 muscles insert into the same point on the calcaneus, okay, which is your heel bone there. All right, so let's go a couple dysfunctions here. We have, here's the gluteus maximus. Gluteus maximus. If we strip that away, you can actually see some of it peeking out the side here, but you can see gluteus medius here. I like when you strip it off so we can see it better. And then we've got this muscle here called the piriformis. It's underneath all those, okay? I mean, it's sort of down below and partially underneath. But there is a nerve that goes right behind that muscle called the sciatic nerve. So if that muscle, the piriformis, gets tight, you have what's called piriformis syndrome, which is probably the most common cause of sciatica. I believe it is the most common cause of sciatica, or at least one of the most common causes. So, got to keep that muscle loose, right? The gluteal muscles also play a lot into low back pain and problems, so we want to keep those loose. Hamstrings muscles play into lower back because of the attachments, so we want to keep those muscles nice and loose as well. Now, let's see, a couple more things. This is your iliotibial band. Make sure we can see that okay. Iliotibial band. Let me just pull another guy in here. So let's pull him in here just so we can see the iliotibial band. Woo, a little bit better, just because it's colored. So iliotibial band, let's go on this side here. And then that comes up. And then there's a muscle there called the tensor fascia latae. And that, I always call it latte because it makes me think of coffee. So that muscle right there is the muscle that attached to the IT band or the iliotibial band, AKA iliotibial tract, okay? Now, people are talking about rolling out and digging out the IT band. You're not. This is dense connective tissue. You're not actually going to be able to like dig that out or anything. There are muscles underneath it. There's the vastus lateralis underneath it that may get tight. There's this muscle. Let's move his arm out of the way. Let's get out of there. So we go here, we come up the IT band. That tensor fasciae lata muscle definitely can get tight and then tighten up the IT band. So this is the muscle you want to target if you want to loosen the IT band, or you can roll it to kind of loosen the underlying structures, which is, I believe, primarily going to be that vastus lateralis, okay? So just remember, you're not loosening up the IT band. What you're doing is you're loosening up the muscles and attachments that connect to it. There's even a gluteal attachment. You can actually see it here. There's a gluteal attachment to the IT band, okay? So you want to keep all that stuff loose, all right? Now, what else do we have? Let's see if we can see the psoas muscle in here. We have, I believe this, let's pull off his little junk there. So I believe this is showing, let's see what we got. We've got iliacus, we've got psoas major. Let me see. Maybe this is hard to distinguish which one they're showing as psoas, but it's about in there, okay? Let me just make sure. 1, 2, yeah, I believe that's a psoas muscle there. Well, that's what this is representing. So underneath, so this muscle actually attaches to the inside of the leg. It's called the lesser trochanter on the femur, the thigh bone here, and it's actually going to go up. It's a big muscle. It fans out. It attaches to all 12 lumbar vertebrae, which are the vertebrae in the lower back there, and to the 12th thoracic. So it attaches to all of those. If that gets tight, can cause lots of back pain. If it gets real tight on one side, it can actually cause little hernia-like pain. It's not a hernia, but it feels like it maybe. Might feel like an ovarian cyst. Of course, get that stuff checked if you think those are possibilities. But these are some muscular issues that psoas major can affect. I wish I could open that up a little to show you the muscle better, but this doesn't do that. So let me see if our other guy has a better version. We've got, yeah, this for sure is what they're calling this. Let's see, 1, 2, yeah, I believe, this one's a little tough too. Either this one or this one, but technically it should be this one because that angle doesn't look right. So this is the psoas major. Again, you're only seeing a little piece of it, all right? Now, what else we got? I want to wrap up with one more thing. Don't want to skip anything. I think this is it. Oh, I knew I had something. So if we go down here, we're going to look down at the lower legs here. By the way, this is a thigh, this is a leg. Anatomically, we always call this whole thing the leg. This is thigh, this is leg. So when we say leg anatomically, we're talking knee to ankle. This is your shin bone. It's called the tibia. If you go just lateral to it, there's a muscle there called the tibialis anterior. And that muscle, if it gets tight and it splints, it can cause what's called shin splints, okay? So that is responsible for anterior shin splints, keeping that loosened, maybe rolled out or however you want to treat that. But that one is really important because that can actually cause microfractures in the tibia when it gets tight. It can start to pull away from the bone if it gets super tight. So those are some problems. So those are our 3 videos. I'd like to do some more, but that's a lot of stuff. So hope you enjoyed it. Stay strong. See you next time.